Okay, good afternoon. The time is now 4 o'clock. I call to order the meeting of the Health and Mental Health Committee. Copy for this agenda for this meeting may be found on the county website under the tab of the Legislature. Please silence all your cell phones and electronic devices. I ask you all to please rise at this time for the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. During you take roll call, please. Absolutely. Amo, Benelli, present. Ellers,
Here.
Feller,
Here.
Ramos, here. Sutherland, here. Tui,
Here.
Patel, here. 7 present, 1 absent. Thank you. At this time, Lacey Trimble, Commissioner of Social Services and Mental Health, and Todd Prater, Deputy Commissioner of Social Services and Mental Health.
No, Todd, he's just social services.
Todd ditched us.
Yes, he doesn't do the mental health side.
Okay. Very good. So first order is a request to accept and appropriate into the Department of Mental Health's 2025 budget the balance of the Assemblywoman Gunther's funding for the Crisis Intervention Team. New York State has granted the Orange County Department of Mental Health a no-cost extension through December 31st, 2025. The amount is $299,374.94. Legislative request number 8. And a motion. Second.
I know you've heard about these funds a few times over the years. They allowed us to expand the mobile response team, which has been co-located in the Town of Walker Police Department, and to expand peer services. They had a hard time hiring some of the positions, so they didn't expend all of the funds. So this allows us to continue those programs, have the continued expansion of the team while we use the additional funds.
Any questions? Okay. All in favor?
Aye.
Second item is a request to accept and appropriate funds from the New York State Office for Mental Health for the 2023 and 2024 COLA WOGI Welcome Orange Geriatric Initiative increase, $35,256. Legislative request number 9. Second.
The WOGI project, Welcome Orange Geriatric Initiative, is a grant that we have at the Department of Mental Health to provide services to adults over the age of 55 who may need additional support to stay in their home. So it has substance abuse, mental health, aging supports, and peer supports connected to it. They gave us the 2023 and 2024 COLA information very late, so we weren't able to do that last year, but we received the funding, and this money will go, about half of it goes to the agencies in the community that are our partners, and the other half supports us having a community-based therapist who is able to go into the homes, so they can't produce quite as many services, so it offsets the cost of that therapist going into the home and having that travel time.
Any questions, concerns? Gary?
Yeah.
Legislator Benelli?
Thank you. It appears that it's stated it's listed under the city of Port Jervis.
It's not the city of Port Jervis, it's the Port Jervis outpatient clinic.
I said, okay. Are there any other funding going to the cities?
There's none going to any cities. This is just the Port Jervis clinic
It's
that
just
we
their
run.
clinic.
No, it's-
to be.
Yeah, it's our county operated clinic that happens to be in Port Jervis.
Thank you.
No problem.
Anyone else? All in favor?
Aye.
Voted. And monthly update?
So the monthly update, we have an update on naloxone. We partnered with risk management, and we will now have naloxone kits, which is also known as Narcan. It's overdose reversal medication that can be given to somebody who's in the midst of an overdose and save their life. That will now be in the AED kits in all of our county buildings, so it's available to anybody who may need it, whether that's staff, public, it's always there. We will make sure that they are replaced as they expire, things like that. So it's always available in county buildings if we need it. I just wanted to highlight our disaster mental health team a little bit. They have gone out more this year than they normally do. Been doing a lot of support to our school districts who have been hit very hard with some tragic incidents, but also community agencies, local businesses who have experienced tragedies. The New York State Office of Mental Health is actually holding a disaster mental health county planning workshop. It was supposed to be at our EOC on the 28th, but we found out yesterday that it has been moved to Rockland County, so it is still going on. We will still have a team going, but unfortunately it won't be local. And they have asked us to present on our team and how we've been doing this, because we've had this team, I believe, for 15 to 20 years in place in our county. We're working with the New York State Office of Mental Health to also bring fundamentals of disaster mental health training to our current disaster mental health team, just give some additional expertise, and to bring back the psychological first aid training to get additional members training, because this is a volunteer-based team that goes out when we need them. Some of them are county staff, but some of them are also private therapists or community members who've decided to get the training. And we want to make sure we have as many members as possible, because we can't have the same people going out over and over again to these really emotionally intense situations and not have others who can step in so that we're not burning our team out. So we're waiting for the State Office of Mental Health for dates, but that will be coming this year to expand our team, but also provide some additional training for the team that we have. We are also part of the Orange County Threat Advisory Committee with the Sheriff's Office. There are some additional trainings coming in February, VTURC and TURC, which is really focused on the key principles of behavioral threat assessment and management and identifying concerning behaviors. We will have a couple of members with mental health who are participating in the 3-day course as well, so that we are prepared to provide support. I have some of those same team members on the mental health side who have been taking ongoing trainings and clinical support kind of meetings on how to do those assessments if the need arises that we need to do an assessment and make a recommendation about keeping the community safe. Updates on staffing. We filled the Director of Mental Health Program Services position, which was vacated when we promoted Leah Roth to the deputy position, which then left us with a vacant clinic director position in Port Jervis. We have been able to fill that as well. So we are down to just having one staff social worker, because we promoted one of our staff social workers as a vacancy. And I hope to be able to fill that very quickly, because the need for services is very high. As we'll see when we get to the numbers. Our county operated clinics, we had an annual satisfaction survey. I have the data from Port Jervis so far. I don't have Newburgh's yet, but it was very, very positive, with a high percentage of individuals saying that they would recommend our clinic. I believe it was 97% said they would recommend our Port Jervis clinic to somebody else. And that most of the individuals who took the survey felt that their therapist listened to their concerns and cared about them and their families. So really positive feedback. Our corporate compliance report, we did have an external audit from one of our payer sources, an insurance company. The department score was 100%, adult services was 98%, and children's was 96%, just for reference, and 85 is a passing score. So those are really good scores for our clinics. We didn't have any compliance issues and had no self-disclosures in the third quarter. There will be one self-disclosure in the fourth quarter for a payment that we had to send back. A client who didn't tell us that they had a secondary insurance. We find out we have to pay back the insurance that paid us and then bill the other insurance that should have been the one who paid us. Under the new corporate compliance rules, that is a self-disclosure, even though there was nothing intentionally done on our part. So we have completed that paperwork, and that'll be part of our corporate compliance report for quarter 4. As far as our satellites, we have not received any new certificates for operation yet, but we are still waiting on all the same ones. I believe since the last time we met, Cornwall has also started the process of reviewing an MOU and getting that kind of in place too. So that'll be an additional school. I put some data in here for November and December. Our annual data, we admitted over 1,000 people, discharged 892, served 2,507 people. The total services provided exceeded what we were projecting. So we ended up providing 38,437 services. And very exciting, the satellite services was over 10,000, which is about 2,000 more than last year's. So really reaching a lot more young people. Yes.
Yes.
This is great. I'm glad to see this put together after all these years. You kind of get one look, one-stop shop and see what it is. Now, since this is the first time seeing this, people serve, so this is 2,525.07 students.
No, this is total individuals served in all of our clinic programs. So there was 2,507 unique individuals across our clinics, our
Oh,
satellites.
just overall clinics?
Overall. This-
Not, okay, so that's
Yes.
just data not associated with the satellites.
Correct. This is all clinics. Satellites is your last row where you have 10,000
Yeah,
services.
Okay.
I can get you number of students if you'd like
You
that.
know what? No, but I'm so happy to see that after that time period, that the numbers were high. I saw it was 10,000, and that's just in 1 year in our schools. I think that's fantastic, and so glad that this program has taken off as well as it did over the years. And we're lucky to have that. Thank you.
Just a quick question. Schools that are pending, quote, pending, are they, you're waiting for them or we received them and they're waiting to hear from us?
So the ones that are pending, with the exception of Cornwall, we have completed an MOU with the school district. It's been approved by the law department, signed off by the county executive, and we've put it into the state system to request approval. So-
it's a process. I don't want to go to the state.
Yeah, the state does a local field office
So
and
the
then.
school's
a
done
central
everything, we've
office.
done everything.
Yes.
Okay, thank you. Appreciate
Legislator Cheney.
Yes, thank you. I've noticed that some counties have created a leave behind program for not block zone. Has the county been thinking about that at least or looking into it? It's a program where police and EMS receive the kits and are able then to distribute them to individuals who they encounter might need them.
So we've shared information on those programs with all of our partners, but we also have already in place a program where we have peer supports who go out after an overdose has happened and there's a non-fatal overdose. And the peer support goes out, it provides a kit that has naloxone, it has test strips for fentanyl and xylazine, information on resources, and they teach the individual or their loved one how to use the Narcan kit. So we're getting them the kits just in a slightly different way.
Thank you.
I'm so sorry to believe. Depending the state, historically, do we have to wait? Is there a 6-month lag, 3-month lag, or is there a disqualification rate that we have? I mean, or does everything eventually get approved?
We've never had one not eventually be approved. They take varying lengths of time depending on what kind of questions they have. Sometimes it's not understanding the school's floor plan because they're very specific and want to see pictures of offices. And if the school changes their mind and wants to use a different office, we have to supply all new information and things like that. My hope is that they will move fairly quickly. It is one of the governor's agenda items to have more school-based clinics. So I hope that will translate to us having a faster approval rate.
Just so the public knows, we have active, how many at this point?
We have 23.
And we have how many that are in the process other than formal for the MOUs?
We have an additional building in the town school district, Valley Central Middle School, Port Jervis High School, Port Jervis Middle School, and then Cornwall.
So 5.
So-
In the wings.
And we did have to recently go through and add some additional in some of our districts that we already existed in order to take advantage of the higher rate for school-based services. So if a district, we were in multiple buildings, but when they first started approving satellites, they would approve an entire district and use the district address. Now we need each individual building to be approved so that we can get the 150% of the Medicaid rate instead of the normal Medicaid rate,
How many was that total to date?
23.
And I just have, I don't know if there's any type of survey out there, but I've run into issues with helping constituents where they can go to a place and they will get intake rather quickly if they feel that they're in a mental health crisis. But then once that intake is over, they're waiting an average of 4 to 5 weeks for a first therapy appointment. and sometimes longer for a practitioner who can prescribe it for medication. Is there any type of, is there that data that's regularly collected throughout the counties or by either us or by state or?
It is not regularly collected. I can say our clinics, the wait isn't that long, but a private practice doesn't have the same regulatory oversight that our clinics have. We're under the OMH Article 31 regulations required to make a decision whether to admit somebody or not after that first visit within 30 days. So we have to continue to see them before 30-day mark in order to meet the compliance. So they can't wait 4 or 5 weeks for an
And that's
appointment.
just our
But
clinics that
that's-
are under it.
That regulation is for licensed programs. I do know that there are programs who are struggling to have enough staff to meet the demand. Even our clinics, it's more clients than we've ever seen. But we know that's a mandate and we're doing our best to meet that mandate. But if there's an issue like that, they can come to me directly, send them my way, and we will try to work through that and get them in somewhere faster.
I'm more worried about the average person who doesn't know to go to their legislator or their elected official for guidance and seeking help. I had somebody come to me yesterday at an event about their grandchild who's with mental health issues and homelessness. And they're seeking information from me. So that's a wonderful thing. And I'm happy that I can do that for them. But I worry about the people who might fall through the cracks. And I know that one of the things is there's also a huge stigma, even though we're seeing increased numbers of people seeking mental health help, there is still a stigmatism throughout people's minds about going to seek that mental health and also to get treatment and also medication should need be. Things I want to work on with you throughout this year is how to stop that and what maybe develop a campaign here in Orange County. But in order to do that, we need to have the providers available too. So if you have any data on that too, provider limitation and where we're short. I know we're short on mental health beds and I know, when it comes to addiction services too, there's spread out throughout the area. It's one of the things that make it work on you. Does anybody else have anything else? Thank you very much. I appreciate it. Dorian, you want the record reflect that Legislator Benton, Chairman Heath, and Legislator Cheney are also in attendance? Thank you. Next up, we have Lawrence Ledoux, Commissioner of Valley View, and Donna Strecker, Director of Finance for Valley View Center.
Just me today.
Just you today.
Yeah,
Donna, let me fly solo.
yeah, she had to make an emergency appointment to the dentist. She'd rather be here, I think.
I would agree with her on that. Okay, so we have, may I have a motion and second to go over the Valley View financials, monthly financials?
So,
Second.
Thank you.
All set, okay.
Director.
So you have in front of you the Valley View year-to-date for December as of 1/16/2025 in the general ledger. If you look under the 2024 year-to-date actual, you'll see that we've received $13,473,620 in IGT revenue. Our other revenues for the year are coming in at $36,375,606. For total revenues of $49,849,226. On the expense side, personal services are at $19,563,962. Equipment year-to-date is $98,301. Contractual is at $11,564,762. And then employee benefits is at $16,111,579. And then our serial bond debt is at $65,102 for expenses totaling $47,403,706.
And that 13,473,620 from the IGT, that's what percentage is still owed, so no.
So that is, they still owe us the remainder of 2024. There is a footnote there, number one. the IGT revenues recognized December 2024 is for a state fiscal year, April 1st, 2023 to March 31st, 2024. So currently we're owed from April 1st, 2024 to present.
Right, do you have
essentially.
that, do you have that?
I don't have any information on that just yet.
Okay, thank you.
Yep.
Please continue.
Sure. If you look, I'll go over, let's see, the census portion. This here. You look at this page is the Valley View Historical Census for the year. You'll see that we ended with an average of 64.35%. For the month of December, we were at 62.57%. That's based on 360 beds. And then if you go to the larger page, that's the analysis of the billed days by payer source. So we have a complete year here. For December, our Medicaid billed days percentage was 75.47%. Our Medicaid HMO was 3.02%. Our Medicare was 12.23%. Our private pay was 8.84%. And then a small percentage of hospice and none of other private insurance. And then you'll see there for the year, if you go all the way to the right hand, the last column on the right, our total, if you add up the Medicaid and the Medicaid HMO, if you combine the two of those, that comes out to 77.34%. Medicare is at 13.6%, and private pay is at 7.73%, just under 1% for hospice and 0.4% for other private. And this is the total payer days by payer source. And so we ended the year, as I mentioned, at 64.35% based on 360 days, 360 beds, excuse me, and then 85.8% if you base it off of 270 beds, which is what we're actually working off right now because we have the 3 units closed.
Any questions?
And then I have the monthly report. Everyone should have received a copy. I gave you the percentage. So for for December, we had 43 admissions, 25 were new admissions, 18 were readmits. We had 10 deaths, 13 discharges to the hospital, 17 discharges to home, and 1 discharge elsewhere. If you add all those up, that's a net of a +2 for the month. The Valley View CHA census, at the time of this report, is 13. I believe it's 12 today. For December, the CHA had 5 new admits, 10 discharges, and conducted 214 therapy treatment sessions, which were broken down into 111 physical therapy, 82 occupational therapy sessions, and 21 RN sessions. The CHA totaled 2,809 physical therapy and occupational therapy visits for 2024. And then I just wrote about we helped out a local nursing home on December 29th, received a call at 3:18 a.m. from the Campbell Hall Nursing Home Administrator. He informed me that they had a fire incident and he would need to transfer residents to Valley View. I immediately called the nursing supervisor, my director of nursing, to let them know, and I headed to Valley View. Upon my arrival to Valley View, our staff was diligently working to set up a unit to accept these residents. By 6 a.m., we ended up taking 12 residents for Campbell Hall. We were able to feed them breakfast and lunch, and they returned to Campbell Hall by 4 p.m. on the same day. Our Valley View nursing, housekeeping, dietary, and rehab staff were amazing. They treated these residents like they were Valley View residents, and they worked together as a team to get this done. That was great. Yeah, it was really, the staff did a fantastic job. Really be commended for that. So it was kind of very scary.
Does anybody have any questions? So just wanted to touch base on, it's something we've touched base on before in the past, what we're doing for staffing initiatives to try and bring more staff on to get our census above 65%, so get it back up into the 70s and 80s. If for next month, we could get maybe a comparison of what, I know our benefit package tends to be a lot better than what is out there in the public. However, I think it's our salary that's part of it, and then also a shortage, and I know it's a national shortage,
Yeah,
not just here.
we could definitely report on that. We just did a quick analysis because we're really struggling on the LPN side right now. We did a quick analysis on the LPN side, and our payer rates, our hourly rates are very competitive. And our benefit package is better. However, it seems like, I think the issue with the LPNs is there aren't as many LPNs out there. I actually totaled the numbers for 2024 as far as how many resumes we got broken down by LPNs, RNs, and I can share all that information with you, or I could send it to you in an email, whichever you prefer.
It's something Chairman Hines had
Sure.
discussed with me when we were discussing.
Sure. I'll send you the information, and if you want to discuss it next month, we could do that.
Yeah, and if you could CC Dorian and the chairman, on it,
Sure.
please.
Yep.
Um,
Yeah, it continues to be a major struggle, specifically with the LPNs right now. That's our major problem. I'll give you an overview of all the open positions, our 2024 statistics, and
I know you've done a couple of individual job fairs right at Valley View, and I know you've participated in the county, Steve Knobs's job fairs
yeah,
also.
yeah. I mean, yeah. I'll send you the information.
Great, appreciate it.
Yeah.
Legislator Sutherland?
I don't want to ruin
No, go ahead.
your train of thought. The program that you have, the CNA program with BOCES,
Yes.
how is that going?
So originally they wanted to have a program in January, and they pushed it back to the end of February now. So I just sent them an email last week following up on that. They're getting together their instructors in place. So I don't know if it could still happen at the end of February now, but we'll see. So
And would it be still like 8 to 10 spots, or would it?
yeah, it would. Yeah, they want to have a minimum. I think it's around 8 because they need to have a minimum number to sit for the exam, I believe, something of that effect.
Okay.
So yeah, yep.
Anybody else have any questions? Thank you very much.
Thank you.
And please tell Donna we hope he's.
Yeah, I felt bad
he's,
for it. He was a little cranky today. Is that off the record? Is that off the record now? I'm in trouble now. No, I felt bad for her. She was in pain. She needed to go to the dentist, so.
Please,
Yeah.
please wish her our best. Thank you. Oh, boy.
Delete.
Next up, we have Dr. Jennifer Roman, DO, Medical Examiner, Acting Commissioner of Health, Lisa Heath, Deputy Commissioner of Health, and Gretchen Burden, Deputy Commissioner of Health. Hello, everybody.
Hello, how are you?
Good afternoon, how are you? So first up, under medical examiners, we have the request to accept and appropriate funds from the National Association of County and City Health Officials, NACCHO, for the Infection Prevention and Control, IPC, Learning Collaborative for the period of 1/22/25 through 6/30/25 in the amount of $90,000. Legislative request number 323. Can I have a motion, please?
So, second.
Okay. So this is a relatively small and short grant that we've received from NACCHO. It's a mentoring program, and it's going to fund existing staff for a portion of their salary and for them to attend the epidemiological intensive course put on by APIC, which is the Association of Professional Infection Control and Epidemiologists, so in Denver. So that is what this grant is.
Any questions or concerns? Okay, all in favor?
Aye.
Any opposed? Next up, we have the request to accept and appropriate funds from the Health Research Inc. for for the Medical Reserve Corps, MCR, grant for the period of 6/1/23 through 5/31/2025 in the amount of $12,100, legislative request number 7.
So moved.
Motion. Please.
So the MRC, the Medical Reserve Corps, is part of the Health Department and assists when there are emergencies. They have done things like immunizations, but they've also helped out in things like the Green Lake Fire, Highland Falls flooding. And this in particular is a series of things that, once we do them, we get money for them. So in the past, we have attended meetings. We've also instituted a 100% background check for all MRC members. And the money in this grant is going to be used for items that are not covered by the other grants that provide this program. For example, clothing and food. The FEP grant specifically says that you're not allowed to buy clothing with it, and the MRC members, their clothing is getting a little old, so.
Yes, so I had personal experience with them at the Highland Falls flood, and they are a very dedicated and compassionate group of people who are there in somebody's, very worst time of need, and they handle themselves and the situation with grace and compassion, and they're a wonderful group, so thank them for me, please.
I will.
Anybody have any questions or concerns? City College?
It's not a question or concern, it's an accounting question, it's probably not the right time to ask it, but it's not only for this 12,000. I see a lot of grants that are kind of like retroactive. So this is a portion of 2023, it's all of 2024, it's half of 2025. So the books are closed on 2023, I think, for the county. When we get this grant, how do we allocate that money accounting wise? Can anybody,
We put it in the current year's budget. We haven't spent any of this
as a
money.
revenue?
So, yeah, so it just has to be spent by 5/31/2025. We haven't received any.
What, it was never been accrued maybe back
No.
in 2023 or
No,
2024?
no, we have to take it to you first.
Okay.
Legislator Benton?
Yeah, this says this is for childhood-led primary prevention.
Yeah, that's an error.
That is
It is
an
for
error.
the MRC strong.
Okay, that was my question. Okay, thank you.
Do I need to have that corrected?
Yeah, we probably get corrected forms or something.
Can we make that, do I need to make the motion?
The award and the project number listed on the schedule are correct.
Do I need to do, okay. Thank you. We can get that corrected from the forward now. Thank you. And now we have the monthly update. Oh, we have to go. Oh, sorry, forgive me. All in favor?
Aye.
Any opposed? Now we have a monthly update.
So you'll be relieved to know I'm not going to read all of this, but I did want to. I did want to tell you a little bit about what's going on with a few of the areas of concern that we're having right now. The early intervention program and the continued issues that we have with the EI hub rollout. We talked about that here. We're still continuing. And there's been an additional sort of fly in the ointment, so to speak, because now the state has decided to reduce the payments for telehealth provision of these services by 20%. So we're following that and seeing if that is going to happen, and we may be back here in another month or so to tell you more about that. If we might beg your kind assistance again as last time. We are, the early intervention or intervention services does have a program now at the Newburgh Armory where families can come. You can, if you look at the Department of Health's Facebook page, you can see some videos. They're providing information about childhood development to the families who come, and the kids and the families get to engage in some fun musical and art activities. You probably all know somebody who's sick. RSV, flu, and COVID are all circling around. The rates for all of those have increased dramatically after Christmas and in the beginning of the new year. And also norovirus, which is a GI type of virus. That's not a reportable disease, so we don't have any information about the incidence of that. And many people are, they don't test for it when they go to the doctor. But I guess our safety tip of the week is that hand sanitizer does not kill norovirus. Make sure you wash your hands with soap and water to prevent the spread of that infection. The flu, we're up to 3,410 cases as of last week. And RSV continues to increase. We have heard some information from the State Health Department and the CDC about the possible testing of milk from dairy cows for H5N1. We haven't heard how that's going to roll out in Orange County. Previously, the State Health Department was mostly focused on counties in New York that had high dairy farms in them. So we haven't heard how it might affect us, but we are watching. And of course, because it is an avian flu, those folks who work around poultry or might perhaps have a backyard flock need to always be careful when handling a dead animal or a sick animal. The lead rental registry is coming. The regulations have been promulgated by the State Department of Health. They are now in the notice and comment area, and we're looking to partnerships with Middletown and Newburgh, which are the areas of concern regarding lead in rental homes.
Thank you, Chairwoman. I see here that you've only been successful in meeting with the city of Middletown. I guess more context would be helpful in terms of Newburgh and what has prevented a meeting. Just trying to see if I could be helpful more than anything. Yeah.
Well, I appreciate all the help that we can get. We have reached out to the city of Newburgh when this began to be a thing. It looked like, and we haven't really had any success in setting up an appointment with them thus far. In the beginning, we were hesitant to really reach out until we saw the regulations. And those have just come out in the last month or so. So we will be redoubling our efforts to get in touch with them.
Okay. Happy to help out right now.
Thank you.
No problem.
And then the health department will have a sweetheart screening on February 8th. We are collaborating with a number of community partners to provide free screenings. And we will be at the Nest, which is opening at the Newburgh Free Library, which is a lactation station. And that's also supported by the health department's Breastfeeding Friendly Orange County grant. We also have a number of enforcement hearings that are going forward regarding TUPA violations, mostly for flavored vapes, but some for sales of tobacco products for underage folks. And the new medical examiner's office is open, and I hope you've all had a chance to see it. We're all we're all very jealous. And, and we're happy that they have a wonderful place to work. And that, more importantly, families of the folks who pass away in Orange County have a respectful and place to view their deceased. Thank you.
Do you have any questions? Thank you. Appreciate it. Have a great day. Next up, we have Chairman Kevin Heath, Legislature. Resolution appointing members of the Orange County Legislative Valley View Advisory Committee, a special committee of the Orange County Legislature pursuant to Section 2.2Q of the Orange County Charter and Article 4, Paragraph G of the Legislative Manual. Can I have a motion and a second?
All right, this is just an update of the names. It adds Chairwoman Tortel to the committee. It adds Mr. Flanagan from the County Attorney's Office to the existing committee that was created in 2019. And the committee will be meeting at 1 o'clock Thursday, I think it is, right? Yeah.
As you know. Have any questions? All in favor?
Aye.
Any opposed?
Thank you. Any motion?
That clears the rest. So can I have a motion to adjourn, please?
So moved.
Okay. All in favor? Aye. Thank you.
You two are busy.
No, I sure did not.